Hi, this is Amy Lee, and I'm going to introduce this project, which is doing an SROI, or Social Return on Investment, at the NEOMED Free Clinic. And I'd like to introduce a guest. Her name is Linda Mervin, and she is the clinical coordinator for the NEOMED Free Clinic, and eventually is going to be a practicing nurse practitioner.
Yes.
So here she is.
Hi, nice to meet you.
I'm going to have her just give us a little bit of background about the NEOMED Free Clinic.
Okay.
Linda?
So we have been a NEOMED Free Clinic that provides healthcare for free to any underinsured or anyone that has no insurance for healthcare needs. We have evolved over the years. It has started out in 2016, and we are now currently offering behavioral health services for a counselor that comes in once a month. We also have a nephrologist that comes in once a month. And we also have an ophthalmologist who comes in and does retinal exams for diabetic patients. And then we also see chronic health diseases as well as physical annual exams. So those are all for free. So,
Wow.
Yes.
Everything is free.
Yes, everything is free. Labs to the limited. I mean, we do basic lab work that we need.
Yeah.
Yes, yes.
So about how many people do you see, I don't know, per week or per month? And what are the hours that you see everyone?
So we see patients every Saturday. The clinic is open from 8 to 11. We usually run to about 2. So we can see anywhere to 15 patients or more. It has been increasing with new patients. Every week we get new patients. A lot of patients are losing their health care if they lose their job or limited coverage. So they're very, very appreciative of the clinic. So yes.
Have you been seeing an increase in volume lately?
Yes, yes.
Oh, wow.
Yes, we have, yes.
So this is my last question. The reason why I'm having the students do this project is because as a free clinic, it doesn't earn money, but you spend money to be able to provide the services. And, you know, as an organization, why should NEOMED support an endeavor that, you know, costs them money, but, you know, doesn't bring back any money in return? I mean, wouldn't a business just kind of go out of business? What is the reason? And this is also the basis for the SROI.
So actually, NEOMED, we at the NEOMED Free Clinic, we actually apply for free clinic grants. So that is how we run, is through free clinic grants. There's a multitude of them that we get along with Portage County. We also have donors. We do have a donor from Southwoods. It was previously just Southwoods Hospital in Boardman, Ohio, but it has expanded, but they have donated a good amount of money for us. This past year in 2025, we won an award.
Oh, yay.
Yes, a golden award for the one of the best free clinics.
Wow,
Yes,
in the
on
state.
that. Yeah, so I'm not sure exactly what the name of it is, but I can get that for you for the name of that.
No worries,
award.
they won an award.
Yes.
And it was very competitive, I'm sure, because there are a lot of free clinics that would vie for this award.
Exactly. So that's how we, you know, pay for everything is through that. Also, by providing specialist services. So mental health is one of those big, one of the big healthcare issues in our area. And we do also provide for Portage County, Stark County, Mahoning, Warren County, Stark County. I mean, we go all over, even into Cleveland. So patients come from everywhere just to see us. Yes.
So I'm thinking a big basis for this free clinic, as other free clinics, is that people who don't have the means to be able to get health care can go somewhere.
Yes.
And it takes a little bit of the burden off maybe some of the emergency rooms.
Yes,
and
immediate care.
Yes.
For chronic health management, that's what
Right.
they need. So they need to have visits because there is a lot of people in the community that don't even see physicians just because of that reason. So this will help them get healthier and also be able to get their mental health better. So having those checks along with anything that they would need for, becoming healthier in their lives. And it also, the education, being able to have the experience for the medical students and also the pharmacy students, maybe eventually with the dental students, but we get those students that come in and they volunteer their time, and that's how they learn how a free clinic is run. So they come in, they see the patients, and then they collaborate with the volunteer physician, and then that's how they go about getting their experience with that. So they go in their teams. So this is one of the rooms, like I said, that they go to during our clinic. And so they break up into teams. And so they're the ones who are writing the care plans and everything for the patients. And then we also give out resources that a lot of the community is not aware of. Yes, other than healthcare. So if they're not sure where to go, we always have those resources available for them for like any of the social determinants, behavioral health, all of that. So,
well, thank you, Linda, for
Yes.
taking some time out of your day to speak to us. This is one of the maybe many safety nets in
yes,
the community
definitely.
for people who can't access healthcare. So we hope that through some of the work in this class, putting together a social return on investment, they'll be able to convince administration that a free clinic is such a valuable resource in the community, and that hopefully your work in the Health Services Administration and Public Health course, you'll be able to help them continue.
As well as the medical students and pharmacy students, they get the experience.
Well, we
So
have
they're
public health students coming in through
and
here
public
too.
health, yes,
Right,
that's
right.
We have been. We
right.
actually have been. So
Right.
we've been working on that too, the determinants of health. So we are trying to work with our local community healthcare or health department. So maybe we can work with some of the other ones as well to get on board with that.